Hello, in this tutorial we are going to visualize electrolyte imbalance on ECG. So for the electrolyte imbalance on the ECG, the major ion that you have to evaluate on ECG is potassium ion. That is the major detrimental ion associated with the heart. So we are going to start off with hypokalemia and hyperkalemia. Those are the major things. That's the major electrolyte we're going to visualize in this portion, because this can result to a sudden death in patient. Is it clear? So we start with hyperkalemia. Is it clear? Hyperkalemia. Now you need to know that what hyperkalemia is defined as when you have a potassium ion level of greater than 5.5 milli equivalent per liters. Is it clear? Now, generally, you have to know that the potassium level of blood that can be associated with a disorder in the heart is when the potassium level is greater than 7 milli equivalent per liter. It is when the potassium level goes as from 7 milli equivalent per liter that it start affecting the heart, resulting to arrhythmias. Is it clear? Now, you need to know that what? You need to know that you should visualize every time that the patient has hyperkalemia, you should ask for an ECG in order to visualize if there is any arrhythmia of the heart. Is it clear? Because in the management of the hyperkalemia, the most important thing is to reduce the potassium ion level. Is it clear? The management of hyperkalemia, the most important element is to reduce the potassium ion level. If you have a potassium ion level that is greater than 5.5 milliequivalent per liters, the management states that you have to reduce the potassium ion level. But now the management is going to be changed. The first line management is going to change if the potassium ion level results to an arrhythmia at the level of the heart. Is it clear? That is why every time that you have a high potassium level, you should do an ECG. After doing an ECG, you have to visualize if there is an arrhythmia on the heart. Every time there is an arrhythmia of the heart associated with the potassium level, your first line management should not be the reduction of the potassium level, but it should instead be on cardiac stabilization. Is it clear? Cardiac stabilization by an appropriate antiarrhythmic drug. Is it clear? An appropriate antiarrhythmic drug, because the patient is not going to die of the high potassium ion level. No, the patient is going to die of that cardiac arrhythmia resulting to the cardiac arrest. That is what's going to kill first that patient. So the first line management should not be reducing the potassium ion, but first to stabilize the heart with an antiarrhythmic. And the appropriate antiarrhythmic that is used with high level of potassium is calcium ion. So you can give calcium gluconate, calcium carbonate. So those are calcium ions molecules. They are appropriate stabilizers, antiarrhythmics used when you have high level of potassium. Is it clear? So this should be an advice, because the heart is one of the most frightful organs. It is one of the organs that you usually don't have any problem with it, but when it starts its problem, particularly arrhythmias, it is extremely frightful, because the patient can suddenly die after a period of a safe-free period where he had no symptoms. Is it clear? So that is why you should always know this tutorial on antiarrhythmics for cardio patients. Okay, so now what are the signs of hyperkalemia on ECG? So the signs of hyperkalemia on ECG, the first sign that you are going to have is a tall peak T wave. Is it clear? The tall peak T wave, as we said initially, we said that the tall peak T waves are going to be diffuse on all the leads. You're going to have the tall peak T waves. The next thing that you are going to have, you have the absent P wave. Is it clear? When you have absent P waves, is also another sign of hyperkalemia. Is it clear? So when you have absent P waves, another sign of hyperkalemia. The next after that, you have a sine wave. Is it clear? When you have a sine wave formation, so it's already very bad. Is it clear? The next thing after that, you have the PR interval prolongation. You have a prolonged PR interval, prolonged PR interval. Is it clear? Prolonged in PR interval. So the prolonged PR interval just tells you that what hyperkalemia results to heart blocks. Is it clear? It block the heart. So and that heart block can easily result to a cardiac arrest. Is it clear? So hyperkalemia is going to result to heart block. So you have a prolonged PR interval at the beginning. That's even the first sign that you're going to visualize, prolonged PR interval. Then the next sign you visualize is the tall peak T waves. Is it clear? The next sign you visualize is absent P wave, and the last sign you visualize is the sine wave. Later on, after the sine wave, you are going to have the cardiac arrest. Is it clear? Cardiac arrest, where you are just going to have a line. So how do you evaluate for tall peak T wave? Tall peak T wave, you have a T wave that's just like that. Is it clear? If you have a T wave that is just like that, it's a tall peak T wave. For the absent P wave, is already known. For the sine wave, you have something like that, just like a sine curve. That's the sine wave. The prolonged PR interval, you have already visualized, and a cardiac arrest is just going to be shown as a line. Is it clear? So that is the sign of hyperkalemia on the ECG. The next is hypokalemia. Basically, so hypokalemia. So hypokalemia is going to have the typical same signs like hypercalcemia and hypermagnesemia. They are also going to have the same sign just like hypokalemia. Is it clear? So for hypokalemia, the first sign, generally hypokalemia is defined when you have a potassium level of less than 3.5 milliequivalents. Similarly, per liters. Similarly, when you have hypokalemia, you should not first start. The best management for hypokalemia is to give potassium to the patient. Is it clear? So that's the best management for hypokalemia. But when you have already signs of cardiac dysfunction, you should first start by stabilizing the heart. When you have signs of cardiac dysfunction, first start by stabilizing the heart with an appropriate antiarrhythmic method. Is it clear? So hypokalemia, so the first sign of hypokalemia that you have to note is that you have inverted T waves. Is it clear? When you have inverted T waves, you have flat T waves is another sign. Inverted T wave, flat T wave is another sign. You have prolonged QT interval. Is it clear? Prolonged QT interval is another sign. Is it clear? And you have also the presence of U waves. Is it clear? So all these signs are also signs with hypercalcemia. So these signs are signs also with hypercalcemia or hypocalcemia, hypermagnesemia also. Is it clear? Now these are generally the signs that you have to visualize. So hypercalcemia is going to present just the same signs with hypokalemia, and also hypermagnesemia is also going to present the same sign with hypokalemia. Similarly, hypokalemia can also be as a result of the signs of hypokalemia can be as a result of beta agonists like salbutamol. Is it clear? Can be as a result of beta agonists like salbutamol. So all this can also be associated with that. Is it clear? Or even insulin, because all those induce low level of potassium. Now, after hypokalemia, so inverted T waves, you just know that it has to be, the T wave is going to be inverted. Flat T waves, you have a T wave that is going to be much more flat. As such, you have a prolonged QT interval, you measure it from the corrected QT interval, and then you have the U waves, the presence of the U waves. So those are the general things. Now, the next thing that you have to visualize here are the complications. Is it clear? Complication of hypokalemia. When you see these elements of hypokalemia, the management is easy. The management is just to replenish potassium. Is it clear? That's the major management. But now, when you have hypokalemia associated with this complication, and the complication of hypokalemia, the first complication of hypokalemia is torsade point. Torsade point. Is it clear? And the next complication of hypokalemia is ventricular fibrillation. Ventricular fibrillation. When you attain this level at hypokalemia, you cannot just manage it again with potassium level. No, it is not just replenishing potassium that is going to help. It is going to be an appropriate cardioversional or an appropriate antiarrhythmic method that should be used here. Is it clear? So in torsade points, how can it be visualized? If you have when you have a prolonged QT interval, you have first a prolonged QT interval plus polymorphic QRS complex. Polymorphic QRS complex is equal. It is associated. It is what is dorsal point. Prolonged QT interval plus polymorphic QRS complexes. It is dorsal point. Now, for prolonged QT interval, as we have already said how to measure the prolonged QT interval is by measuring the corrected QT interval using the Basset's formula. For the polymorphic QRS complexes, these are QRS complexes that are dysmorphic. One, you have first these are QRS complexes that are dysmorphic. It can be like this. So this is one QRS complex, that's a dysmorphic QRS complex. And now, these dysmorphic QRS complexes are also going to have a change in polarity. Is it clear? So when you have dysmorphic QRS complexes, that change in polarity or there is with a change in amplitude, it is called a polymorphic QRS complex. So let me just draw how polymorphic QRS complex is example. So in this case, at the beginning, you can have this. You have a positive wave, then you have this wave like this, then you have a wave that is predominantly in this direction like this, then you have a wave that is predominantly in this direction. So these are polymorphic QRS complexes. At the beginning it is predominantly positive, then it is predominantly isoelectric, then it's predominantly negative, then it goes predominantly negative. So those are polymorphic QRS complexes that are shown in a case of ventricular tachycardia. While in the case of ventricular fibrillation, you have said you have just fibrillating waves. Is it clear? Every time that you attain a stage of dorsal point and ventricular fibrillation, you must go down to cardioversion. And cardioversion can either be done pharmacologically or it can be done particularly in ventricular fibrillation, is going to be done electrically. Is it clear? Electrically with a defibrillator. Is it clear? So those are the different things that you have to evaluate when you have these patients here. Now, the next element that you have to evaluate after that, so after that is now, so we have already seen all the major signs, hyperkalemia. And lastly, what I've forgotten to tell you, these U waves can also be located in hypercalcemia and also in the patient with all extreme ages. So from here we say thanks for your kind attention. Please don't forget to like and subscribe for our channel. Thanks very much.